I think it's all about understanding where your passion lies. One of the things is that people are, I think, scared to explore, or when people, I would say, get a degree, or have, like, go through the traditional paths, people are scared what will happen if I kind of deviate a bit. But I think what I did was, how do I understood my skills, what's my medical skills that I have that can be transferable to something else. What skills can I, how can I blend my public health experience with my medical skills to build something, or to penetrate into different markets. One of the things that I do also is, like, I would say project management. But at the end of the day, is what understanding what your passions are, understanding that where is the gap that I want to fill. So I'm a medical doctor. With being a medical doctor, what aspect of medicine do I want to focus on? So people go into practice, specialty, and all of that. For me, I really enjoyed public health. I knew I wanted to prevent, things. I wanted to build something that would support women. Especially during my masters, I I was really drawn to maternal health and all of that. And during my research, the statistics I saw, especially for Black women's health, it really shocked me. And I was like, this is something I wanted to do. But mixing, building a startup at the same time, an NGO at the same time, work and all of that is a lot. Is a lot. But what I did was just prioritize, understand what are the key pillars. So I have a startup. This is what needs to be done with this. I have a foundation. This is what needs to be done with it. What are the things I need to plan for the next 1 year? What are these things that we need to put in place? So it's not something I have to wake up every day wondering what we are doing. So I know that this is what the startup, the direction of the startup, this is the direction of what we are doing with the platform. In the next 3 months, for example, we need to get 5,000 users, that are Black women that will use the app. Then I create a roadmap, to achieve that. And then also not working alone, having people. um for example, I'm not in Nigeria at the moment, so I cannot be there physically to do some of this work. It's building a team, making people understand the vision that I have, that this is what we need to get done. This is the direction we're taking in the next 1 year. Break it down into weekly bits, or this is what we need to get done. And then people jump on it. All I'm doing is basically strategizing, making sure those things are implemented. And when it comes to the app as well, is breaking it down, having weekly meetings, making sure I'm on top of that. But having a calendar, it also helps, because um I think when I started, I was really, on top of it. Like, I know what I need to do. I know I know I need to be in this meeting by 4 o'clock and all of that. But I started losing, little bits started falling off. So what I did was also build a structure around, this is my calendar. I know this is where I need to be by this time. This is the meeting I need to get on by this time, and all of that. I think the team has also been helpful to make sure that we are on top of things. Yes, on this.
Yes, thank you for that. I think one key thing I want to take away is you are really talking about how even when we get degrees, even when we
Yeah,
learn something, we should think about it beyond just that degree, beyond just that certificate. Is it transferable to other areas of life, right? Is there something
yeah,
that you want to work on that this skill might be relevant to in whatever way, shape, or form? Really, that's how we able to transfer some of these skills. Yeah, I also did public health in school, but I never thought about having a health startup. But so you
yeah,
see a different view, to
yeah.
look at some of the skills that you have can, lead you to doing something else that is remarkable. Yeah.
I've always